must constantly look at things in a different way.
The Healthcare Education Transformation Podcast was created by two physical therapists out of the desire to learn more about the different educational roles in physical therapy and healthcare, and how healthcare education works by talking with educational leaders and people with different perspectives within physical therapy and across interdisciplinary lines on how education can be improved to disrupt the status quo of healthcare education. This is our journey, and thanks for listening. Are you a third-year physical therapy student that excels on tests when you have study guides, checklists, and deadlines? With all of the information available about how to prepare for the NPTE, it's easy to get disorganized and not feel prepared going into the big day. NPTE Prep Success is an online course that provides PT students easy-to-use study guides and step-by-step guidance through the NPTE preparation. To learn more, visit kylericeprep.com. Thank you again all for your continued support, and now for the show.
Hi, everyone. Welcome to another episode of the Healthcare Education Transformation Podcast. I'm your host, Stephanie Wyrock, and I'm joined by my co-host, Brandon Poen, who he's in Starbucks right now. So his volume is it's a little too loud in Starbucks, so he's just kind of hanging out in the background. But we're joined by three special guests today, and we're going to be talking a little bit about telehealth. At the Educational Leadership Conference this year, which our podcast team attended, they had an Oxford debate where they talked about, each team talked about whether telehealth should be considered a core competency in doctorate of physical therapy education. And today we have the pro team. So the people that are joining us today think that telehealth should be a core competency in DPT education. The first guest that we have is Dr. Alan Lee, and he's a professor at Mount St. Mary's University. We have Katie Sutton, who's the academic coordinator of clinical education at Kent State University at East Liverpool's PTA program. And we have Dr. Zachary Rethorn, who is the faculty development resident at Duke University. So Dr. Lee, Ms. Sutton, and Dr. Rethorn all represented the pro team at ELC. And I just want to kind of let them tell you a little bit about themselves, kind of why they're passionate about this topic, what makes them experts. So let's start with you, Dr. Lee. Tell us a little bit about yourself and kind of how you got into this topic.
Yes, definitely. Thank you, Stephanie. Thank you, Brandon. And hi, Zachary, and hi, Katie. It's good to see you guys, as well as hear your voices real soon. So thank you for inviting us. And myself, I've been in telehealth since 2006 when I was involved with the VA study on telerehab. And slowly but surely, I got pulled in by APTA to work with the HPA Technology SIG, as well as the APTA First Council, including the telehealth lead there. So again, thanks for inviting us and myself to this podcast.
Well, thanks for joining us, Dr. Lee. How about you, Katie? Tell us a little bit about yourself and kind of what makes you passionate about this topic.
Well, hello, everybody. Thank you, Brandon. Thank you, Stephanie. It's great to be joining you today. Hi, Zach, and hi, Alan. Good to see you and talk to you again. I am probably the team member, I would even venture to say from both the pro team and the con team, that has the least experience with telehealth. Which is a very interesting spin on the subject. My eyes were open to a lot of new topics. And it was interesting to take that on. So while I don't have a lot of experience in telehealth or telemedicine or telerehab, I do have a passion for PT and PTA education. And I love to find new ways that we can reinvent ourselves. So that would be my experience with telehealth.
Wonderful. It's always good to get differing perspectives on a topic like this. What about you, Dr. Rethorn? Tell us a little bit about yourself, kind of what makes you passionate about this topic and how you got to where you are today.
Yeah, thanks, Stephanie, and thank you both for having us on today. My passion for telehealth is a somewhat recent phenomenon, I will admit that. I really got interested in this at the beginning of this year when I took on my first academic role as a faculty development resident here at Duke. I was really unable to find a clinical position which still fit my needs as an academic and allowed me to maintain a clinical practice. So I started looking for how can I still be involved in patient care? How can I be involved in something new and something interesting and learn about maybe where our profession's headed? And that's really what drove me to consider a digital practice. So I've spent the majority of this year looking at literature and building out a small business to be able to see patients in a digital environment. So my experience with telehealth is as a practitioner, but also as an academic a little bit now, and hopefully more in the future.
Wonderful. So I know at the debate, so if anybody's never been to an Oxford debate, either at the APTA Next conference or at the Educational Leadership Conference, each team, it's kind of a fun little debate. So each team kind of dresses up or has a theme that they go off of. And your guys' themes was like a Hawaiian theme to kind of give the impression that we can use technology to relax a little bit and make people's lives a little bit easier. So let's start off with establishing some clear definitions of what telehealth is and why it's important for the remainder of discussion. So how do we define telehealth?
I think that's a really great question to start off with. And unfortunately, there's not one answer. The reality is that different folks define telehealth in different ways. So the Health Resources Services Administration defines telehealth as the use of any modality for remote clinical services. And that includes more than just a face-to-face clinical visit. It includes synchronous and asynchronous use of technology. So sort of a real-time use of technology as well as a not real-time use. And it also refers to the use of digital modalities for training purposes and for continuing education and for meetings as well. So depending on who you look at, you might get different definitions. The American Telemedicine Association uses telehealth, telemedicine pretty interchangeably. And I think really the term that I'm preferring these days, and I'll see what my colleagues think as well, but I really like the term digital practice for describing what I think most people have in mind when they hear the word telehealth. And so coming out of the WDPT white paper about telehealth, digital practice is a term used to define healthcare services, support, and information provided remotely via digital communication and devices. So it's a very simple definition, but it's one that I think encompasses a lot of these different aspects in a way that's very clear to understand.
Yeah, I think that's those are some good points. And as we said a little bit earlier, establishing what that definition is really important, first of all, in a debate. As a former debater myself, and also a former Oxford debater at Next, it's always good to set up the definitions right away so that each team knows exactly what they're debating, because there can always be some nomenclatures around with that. So Dr. Lee, kind of going off of what Zach said, I know you've written the white paper on telehealth among other research, but what are the strongest points from the evidence now to support the use of telehealth in PT and PTA practice?
Yes, thanks, Stephanie, and thanks, Zachary, for that wonderful walk through the definition. Since it's a evolving and innovative method, I think when we talk about telehealth research, we have to look inside and outside of our professions. And as you look at where telemedicine has been, meaning again, medical care like nurses, doctors providing through a digital technology or digital practice to see patients and clients, their evidence has been very strong in terms of cost effectiveness, looking at safety of care and non-inferior results in terms of patient engagement through a digital modality such as telehealth. Therefore, we also in physical therapy have been developing evidence within the last decade or two around such as the total knee replacement in different countries, also other diagnoses such as neurologic conditions, and now most recently, again, in breast cancer survivor surveillance. So physical therapy and physical therapists and PT assistants can be involved, not only looking at the literature, but also developing that literature and making it stronger in the future. So that's where we are currently. And most recently at Duke University, they were involved with a study looking at cost effectiveness and non-inferior results with CJR models regarding total joint replacement around total knees. And with around 140 to 145 to 44 patients in terms of usual care compared to telehealth PT care, They found non-inferior results, but also cost savings that would be very interested for not only therapists, but also for other stakeholders in terms of healthcare innovation. So those are the evidence that are developing, but there are also some limitations with this research, such as telehealth in this study was not just a live remote therapist connecting with the patient, but also a avatar that was used to health coach the patients as well. And also biometrics were collected, such as gait speed and vital signs. So as Zachary had mentioned, there's synchronous and asynchronous telehealth measurements that need to be incorporated to provide the best practice, but also best research that's out there. And as I mentioned, some of the limitations real quickly to go over with that study, there were fallers in both groups, in usual care as well as the tele-rehab group, pre-study as well as post-study. Even though post-study, there were only 4 patients who had a fall episode. This was a self-report in the telehealth group. There were also fallers in the usual care group, which was at least 1 patient. But I think the take-home message is we need to be hands-on as well as through a digital modality to have these touch points to make sure that it's very safe for patients and clients. And the takeaway I would take away as the last point would be the rehospitalizations in that study. There were 20 patients, or 20% of patients were rehospitalized in the usual care group, while there were less than 8% rehospitalized in the telehealth group. Therefore, if you look at not only CJR models, but look at innovations that are coming along with healthcare reform, that hospital rehospitalizations are a big point to as therapists to kind of keep in mind, and maybe telehealth or digital practice will limit some of those rehospitalizations or make sure that we keep our patients at the right time, right place, at the right moment.
Yeah, and for those of you that maybe aren't familiar with the CGR model, it's basically a payment model that that is being used to pay back for joint replacements. So you get a bundle of money, and then based on that bundle of money, all the services that go into somebody with, like, say, a joint replacement or something, ends up getting paid out to the providers. So just some defining features there. Zach or Katie, do you have anything to add on that about, like, the effectiveness or the safety, the cost effectiveness or limitations of telehealth?
So looking aside of the research that Dr. Lee has just went over, I had to dig in a little bit to find out, are there effective PT and PTA teams that are actually doing this out in the real world? And what I had found was there's a place called Infinity Rehab, and in specific locations in Washington State, they have implemented successfully and legally. They kind of spearheaded the use of telerehab to allow the PT to perform a 5th visit, supervisory visit with the patient, utilizing the services of the PTA on site. So the PT is doing a digital physical therapy supervisory visit, and the PTA is performing interventions and data collection at the direction of the PT. And this has worked out very well, it seems, for this specific rehab company. And I really loved that concept because I thought it was an interesting way that we can combine the PT-PTA team and truly see that PT as being the right-hand person to the PT. So I really loved finding that information because I had a hard time finding a lot of PTAs who are actually doing this right now. Not to say that it isn't out there, I just didn't run into too much during the research I was digging up to prepare for our debate.
I think one other thing I would add is that there are a lot of gaps in what is unknown from a research perspective right now. So the study that Dr. Lee mentioned, is interesting because it's a virtual PT program where it's almost a digital coach, right? It's not even necessarily a complete care by a physical therapist. There's this component where the virtual care is also being provided by this digital avatar. So I think that that's a very interesting model to take, that, look, perhaps components of our care are really best used by digital avatars or by other means of delivering these services, that it may not need our in-person expertise. And so what that does is it frees us up to practice really at the top of our licenses to say, what is the best use of our time and our resources to help patients, and where can technology assist in some other areas that maybe we don't need to be as active in, that technology can provide similar outcomes than what we could do as well. So that's an interesting point for me. I think one of the other outcomes from the Veritas study that I found interesting was that in addition to all of the outcomes that Dr. Lee mentioned, all of the traditional visits plummeted in the group that was having the digital intervention. So home health visits, outpatient visits, physician visits, all plummeted. But the communication with physical therapists, which is calls or emails, was exponentially higher. It was like 817 calls or emails compared to 19 in the control group. So there's still a communication happening. There's still interaction happening between a PT and a patient in this kind of model. It just looks different than what we would traditionally think of. And I think that's an important point, that this is not a wholesale, sort of selling out of the profession. It's the same things we're doing, just in a different way.
Yeah, and I would add that coming from a background where I've done rural healthcare, telehealth is a really great way to get people to actually, quote unquote, get into the clinic when things happen where they can't drive to your clinic, or the weather is bad, or, right in Connecticut, we just had this huge ice storm go through, and, many of our patients canceled. If we would have access to telerehab, potentially that would be time that we would be able to spend with them. The next question that I would add to that is, what about payment? That's kind of a hot topic right now in telerehab. How are we going to pay for this? Is this something that Medicare pays for? Is this something private insurance pays for? If any of you guys can touch up on that question, that would be good.
Right. I'll start off again. And payment is a key area where our advocacy efforts could really help. And I think the debate tried to flesh that out for us, which was we should all work together, hands-on, as well as with digital platforms. And nothing different. It's just the way we deliver the care might be thought of as just a tool that we use to provide physical therapy quality care. Therefore, we need to get behind advocacy efforts such as the Connect for Healthcare Act that's currently at the federal level, which will help PT, OT, and speech therapists and others to provide what this research is kind of borne out, is kind of building out right now in not only rural areas, but access to our patients where it's desperately needed. So, real quick, like workman's comp insurance, insurers and private pay have got on board with providing PT telehealth services. So these are contracts that you would have to basically, again, communicate and also discuss, and then make sure the payment is at the same level, what we call parity laws, with third-party payers. Medicaid has also provided PT/OT speech payment for telehealth services, especially when, as you mentioned, Stephanie, where there's no care versus at least some type of digital practice care can be provided. So again, the individual practitioner who is listening to this podcast need to talk to the individual payers to get this payment contract as well as agreement done. And also maybe Zach, you can touch on how you practice, and there's also models regarding cash pay practices as well.
Let me just add, you touched on the Connect for Health Act. So for those of you that don't know what it is, let me just tell you a little bit about it. It was introduced on October 30th in both the House and the Senate. The bill numbers are HR 4932 and Senate Bill 2741. It's a piece of legislation that seeks to lift current restrictions that providers, including physical therapists, face for coverage of care provided to Medicare beneficiaries via telehealth. And then also seeking to reduce financial burden on Medicare by allowing enrollees, enrolled providers or suppliers to be reimbursed for care provided by telehealth when the quality of care is the same or better at the certain cost effectiveness criteria met, which we talked about before. So this enables Medicare enrolled PTs to actually provide that care to their patients. It requires the Health and Human Services to review and improve the process for adding telehealth services to those covered by Medicare. So this could be a path that would enable us as physical therapists to actually furnish covered telehealth care services to Medicare beneficiaries. And it also authorizes CMS to build models that allow for additional healthcare professionals, including physical therapists, to furnish these healthcare services. So if telehealth is something that you want to do in your practice and you provide care to Medicare patients, you can actually contact your legislator. You can go to the APTA Action app. You can tweet at your legislature online and tell them to support this bill. Like Dr. Lee said, this is a place where advocacy becomes very, very important.
Right, and also APTA has resources for you regarding the research articles we have mentioned earlier, as well as therapist stories. That's, again, within APTA to look at to support your advocacy with your local as well as your federal legislators.
And we will provide those links to you guys in the show notes. So if you're wanting to do this, check out our show notes, okay? Zach, did you want to add anything about cash-based telehealth services?
Yeah, absolutely. So that's the model that I practice under right now, because I honestly just don't have the time or honestly the desire to work with the insurance model, given that this is my sort of side practice and my way to keep up my clinical skills. So I function under a cash-based model, which in North Carolina is wonderful. We have a really nice Practice Act in this state that allows for that. So definitely that's an area to look at as well as the Practice Act to see how are digital services considered. Many states, I believe, require an in-person evaluation before you can furnish digital services. Other states are silent. So it's definitely worth considering contacting your state board or looking at your Practice Act as well to figure out what is the logistics of practicing this. Even if you're using a cash-based model, there are still legal and ethical considerations to take into account looking at starting these kinds of practices.
Yeah, I think that you make a very good point on that. And I think that a lot of the people that I've heard of that incorporate telehealth into their practice right now, a lot of them are doing cash-based services. Do you, Zach, use a certain, so I know HIPAA compliance is always a question about telehealth. Do you have any recommendations for different apps or that you've used or heard of that maybe some of our physical therapists or healthcare providers listening could maybe check out?
Yeah, that's a great question. Thank you for asking that. I think that HIPAA compliance is a minimum bar, right? And security and confidentiality using digital practice and digital tools is very, very important to consider. So it's definitely worth consulting with somebody who knows the legalities around technology and how technology needs to be locked down, especially when it comes to sensitive patient information. It's worth consulting with somebody to make sure that your practice is on solid legal and ethical footing there. There are a number of different services now that are offering HIPAA compliant digital practice modalities. So one of them that I'll say is Anywhere Healthcare designed by a physical therapist, Mark Milligan. And that's a HIPAA compliant method. There are large ones as well. Doxy.me is a large platform as well. And there are many others that you can Google. I'm not necessarily endorsing one or another. You have to find what works for you and your practice. But there are many, many, many modalities and platforms that you can now utilize for relatively low cost if this is something that you're interested in exploring.
And to add to that, Stephanie, maybe on your show notes, you guys can also add most recently in the PT in Motion in November. There was a really nice article around digital practice and ethical and legal concerns. It may, again, allow the practitioners to think through that this is not just a simple Skype or FaceTime situation, that there are lots of, complex issues, just like how you open your private practice to walk through with maybe having a lawyer involved or getting a consultation from other mentors who are out there, trying your best to stay away from things like closed Facebook groups and not doing things on your own, where you need to kind of seek out what the APTA and our other association like the American Telemedicine Association have provided resources for, so that you are doing I would say, really doing the background research, understanding not just the literature, but getting into practice like you would do if you actually had a brick and mortar practice. I mean, you saw I'm sure you've had consultants like lawyers and other mentors who help open your practice. So therefore, it's no different. Again, like Zach and Katie had mentioned, this is just practice in a different way. It's just a tool, but you have to be mindful of all the safety standards to protect your patients as well as yourself.
Yeah, I definitely think that you make a good point that it's important not to reinvent the wheel. I think that sometimes in PT, we have a tendency to do that. So making sure we are using those resources. How do you think telehealth will be integrated in overall healthcare in the future? I mean, let's think really big picture. Like within the next 2 to 10 years, what do you think the anticipated usage will be, and how do you think it's going to be integrated?
I can start off again. I mean, I'm looking at Zachary and Katie, and they're thinking, and that's great. And I would first start with education. That's where the debate started. So I would love to see education in terms of having core competencies around communication, interprofessional communication, including PT and PTAs, involved with digital practice in terms of having some models that they can deliver as well as connect with, just like we were doing here on our podcast. I know some of you cannot see us, but we are all nodding our heads and working together here. So therefore, that's important, building out that patient and provider relationship, but also provider to provider relationship, because I think consultations are important as well as supervision and delegation. So I would see that developing further out. Using our simulations that we have available in our academia already to build this out with telehealth. In terms of practice, I do see further development, but some safeguards. Again, looking at the literature, making sure that, why are we not actually in our total knee joint replacement pre-classes screening out those fallers, right? And therefore, making sure that we provide our current care, but in a better way to make sure that we push out digital practice safely. So with practice, not only other models that are out there, but also doing it interprofessionally with other disciplines. Because Medicare, if you look at the payment for Medicare for telehealth, it's really around providing patients what they need, such as prescriptions and needing that consultation, side consults, and providing that service where there's mental care desperately needed. So we as PTs and PTAs have, I would say, some responsibility around how we push digital practice forward, but safely, but also thinking about where are those gaps, as Zachary had mentioned. So in practice, making sure our workflows are addressed with those gaps being met by telehealth. So I would see that happening. And I think I'm going to let others like Zach and Katie mention what they would think where the future might be as well.
I would just like to tag on to what Alan has mentioned about us gleaning from our neighbors and allies, different ideas from other countries and from different programs, maybe even nursing. They have some really good concepts and ideas that they're using as well. And we just need to kind of glean some information and see how it has worked and what hasn't worked, and kind of create our own way in order for this to be successful over the next couple years, as far as that goes. And like it has already been mentioned, the VA is already doing a lot of telehealth, and a lot of it. So there's definitely some information that we can pull from there as well.
Yeah, I'll follow up on that, Katie. I think you bring up some great points. The VA has really been a pioneer in the use of telehealth, and a lot of the studies that demonstrate the safety and cost effectiveness of digital care have come out of the VA system. So whether that's through remote patient monitoring, so folks who are not able to get to a clinic very easily, we can send wearables and other kinds of remote patient monitoring devices so that they are able to transmit information without needing to come to a clinic. There's some really strong data that's come out of those kinds of initiatives. Within the VA, I think the latest stats that I saw were that in fiscal year 2016, which is a few years ago now, about 12% of veterans were already receiving elements of their care via telehealth. So from my perspective, this is a train that is on the tracks, and it is going. It is not going to stop. It's really going to keep pushing forward. From a big picture healthcare perspective, I think a lot of healthcare systems are realizing the advantages of using this. It enables us to reach people where they are in a way that traditional healthcare models have not been able to do. So I think the important parts then are, well, who's appropriate for this kind of care? What kind of care within a healthcare system is appropriate to deliver digitally? And how can we best leverage the technology to provide better care at a lower cost and improve the health of populations, right? The triple aim. So I think those are issues that are really being looked at, especially among accountable care organizations and other healthcare models that have skin in the game when it comes to improving patient outcomes and reducing costs right now. So I would look at those kinds of models and see what data they're pushing out to really look at the trend here. But, I read a quote online this week, healthcare disruption is going to occur slowly and then all at once. So I think right now we're in the slowly phase, and very, very shortly we're going to reach a tipping point where suddenly things are flipped and everything is different. Where consultations are going to happen much more in a digital environment, where really you're only going to come into an office when you need to come into an office and not when you don't need to come into an office. So I foresee that in the next 10 years, that tipping point is going to shift, and we're going to be at a place where digital practice and digital use of different modalities is commonplace and expected, and consumers are going to demand that, I think. One thing I'll say from an education standpoint as well is as Katie and Dr. Lee mentioned, we don't need to reinvent the wheel when it comes to how we educate folks to do this. So, there's a great paper that came out that said, telehealth is not just FaceTime. There are some competencies that we need to consider as we're engaging in this. But when you look at them, many of the competencies, and a Delphi study out of nursing established that over 80% of the competencies that you need to function well in a digital environment, we already teach in our traditional educational programs. There are things like good communication, good body language, putting patients at ease. And then there are some more specific competencies related to telehealth specifically, like you need to talk a little bit slower and enunciate more to make sure that you are conveying your message appropriately. You need to make sure that what you're doing is HIPAA compliant. You need to understand licensing issues, and if you're seeing folks across state lines, what are the licensing issues that are associated with that? Looking at using graphics, using internet resources, sharing screens to be able to convey additional information beyond just through a webcam. And then what is your background like? What is your environment as a provider like? I think that's important as well. So, how are you able to do a virtual physical exam? How are you able to manage group interactions in a digital environment? Those are all skills that I think we will need to be developing. And the future that I see is that, honestly, every healthcare clinician and every physical therapist certainly will need to be digitally literate. And we're seeing this in some of the major outpatient companies that are now offering free screenings via a digital screen. That who's going to be doing those? You have to have a critical mass of clinicians that are able and capable of functioning well in this environment and providing a good patient experience to be able to really launch those kinds of programs. So the future I see is one in which this is integrated much more fully than it is now. But it's not a I want to echo what Dr. Lee said as well, that this is not a wholesale change. This is a tool to use. And I think we'll see this tool utilized a lot, but it is still a tool to use for us to practice the way that we've been practicing already.
Right. That's really well articulated, Zach. And if you look at the future, or currently actually where it's going in Europe is, where the white paper really developed with, colleagues and experts from the UK, Canada, Australia, and ourselves here in the US through Impetra as well as WCPT, that in Europe, they're already building out digital workforce. So there is not only in academia, they're building out healthcare providers who are digitally, able and capable, but they're actually saying this is the future of our labor, and our workforce needs to be, very mindful of digital capabilities. So we are seeing development there. So we need to just kind of follow the trends, but also be mindful of, how we do this, safely. Just incrementally, but also, things are lining up, such as interstate compacts, payment, licensure. Those are things that are lining up for us. And what's lacking from this debate, we didn't have this much time to talk about, is around those competencies. Like as Zach mentioned, we have to follow some common competencies, and we need further research around what PT competencies look like. So, but we do have some prior experience as well as prior experts, such as we could develop out Delphi studies, and we can definitely move forward together.
Yeah, I think you guys all make some really good points. I even see this transition maybe coming about maybe quicker than what you describe. I feel like healthcare is transitioning into more of a customer service based industry almost. And people are going to want more convenience. People don't want to go into the office a lot of times. So they're maybe more likely to go to a provider that offers telehealth services, especially if it's for something that maybe they like a physical or something that's maybe more preventative. And if our healthcare system is truly going more towards a preventative system, that's going to be something that I think will definitely be utilized more. So I agree with a lot of the points that you guys are bringing up.
Access to healthcare is one of the largest issues facing both providers and patients, as millions of people worldwide lack timely and affordable access to healthcare. Anywhere Healthcare, a telehealth platform, is a simple, low-cost option for providers and patients that eliminates the barriers to access to all kinds of healthcare. To find out more, check out anywhere.healthcare, which is available in our show notes. And if you use the code HET in all caps when you email to sign up, you'll save 25% off the total cost. Thank you for attending class today, and we hope that you learned something and gained value from the content.
If you'd like to schedule office hours with us, feel free to add us on Twitter at HET Podcast, on Instagram, HET Podcast, on Facebook, the Healthcare Education Transformation Podcast, and the homepage, healthcareeducationtransformationpodcast.com.
And for those of you following along in the syllabus, extra credit can be obtained by liking us, sharing us, and leaving a review.
Let's continue our journey up Mount Educational Success as lifelong learners.